Does it frustrate you when you see sort of this concerted effort about science-based medicine that is attacking nutrition as if nutrition doesn't have any science behind it?
It does, because how could it possibly be? There is complete science to all of this.
Yeah.
Okay, and if you look at what they call functional medicine, functional medicine teaches the science and the chemistry of how all of this works.
Yeah.
And like I've said before, there's absolute published research evidence on how this works. If you just take the time to go look, it's kind of interesting. My patients who I see, and they have stage 4 life-threatening cancers, and they're seeing their oncologist, very few of them ask, well, like, why do you look so good? Like, why? You work every day and you work out every day? No. Wow, like, I would be asking my patient, what did you do?
Yeah.
What made you better? I want to know. I want
Right.
to know so I can help my patients, because I don't know everything.
Yeah.
And we all are here to discover what works and what helps and what makes your life work. So why wouldn't a doctor want to know? And like I asked one of my stage 4, she came in, adrenal cancer, which is a very rare cancer.
Yeah.
And she came in a wheelchair, 85 pounds, and now she works every day, works out every day. And she's been with me a couple of years, and I asked her, I said, so, like, do you see your oncologist? She goes, well, I just stopped seeing him. And I said, well, and he actually called her to see if she was still alive. She goes, oh, yeah, I'm still alive. And I said, doesn't he ask you, like, what did you do to look this great? And
No, he doesn't.
no, he doesn't. Like, I would want to know. Like someone tells you about this great movie, right? Aren't you just dying to go see it because someone says, oh my God, you're not going to believe this movie? You'd like want to go and see it. So it's the same thing.
I know, and I hear this all the time from patients, especially that incorporate nutrition, or they may stop using conventional therapies or whatever. When they go back to see their oncologist and they're doing really well, and the oncologist say, oh, what are you doing? And they'll say, oh, I'm juicing, I'm eating raw food, and I'm taking these supplements. And they'll just say, okay, well, yeah, just keep doing what you're doing.
Right, exactly.
You know, and I'm just like, if I was a doctor, I would be like, this
Curious.
is really
Well, you're
interesting.
curious.
Hang on, maybe there's something to this.
Right.
I don't know. Am I crazy?
Right. No, you're not crazy. And so, and even if it does sound kind of different or strange, still go look at it as long as it doesn't hurt you.
Yeah. Is it part of it just sort of like medical snobbery?
Well, a lot of doctors refute hardcore evidence because it doesn't comply with their own theories.
Yeah. Yeah.
And then when evidence does come out, they don't pay attention to it.
Yeah.
So,
and they ignore, the big, I think the big war of ideas is that the strict conventional medicine is evidence-based.
correct.
And it's science-based. And everything else is not.
Right.
That nutritional science is not science-based, and there's no evidence to it. But the truth is, there's tons of evidence everywhere. And what's even crazier is that the evidence-based medicine that is so generally accepted, there are drug recalls every year. Where's the evidence?
Right.
Where's the science if a drug is recalled because it's not working, because it's
and
killing
that's
people?
FDA approved, that they've spent
Yeah.
$800 million researching on the
Yes.
efficacy and the side effects. But look at Vioxx that killed hundreds of thousands of people, and that
Right.
was researched.
Don't forget, Vioxx was science-based, evidence-based medicine.
Right. Well, my mother took a drug when she was pregnant with me, and they found out 16 years later that in offspring, male and female, it caused cancer and anatomical problems and hormonal problems and skeletal problems and all kinds of problems 16 years later.
Wow. What was that drug?
DES.
Okay.
DES was a drug given in the 50s to women to prevent miscarriage
Oh, while they were pregnant?
while they were
Okay.
pregnant. So if you take medications while you're pregnant, it will have an effect. Now they know that Prozac and some of the drugs that are okay in pregnancy, we're finding that they cause changes in the offspring now.
Well, and they've come out recommending chemotherapy for pregnant women.
Yeah, well, yeah.
Is that even worth commenting on?
No.
But hey, stay away from soft cheeses
Yeah.
when you're pregnant.
Right.
But chemo's fine.
Yeah, chemo's fine, exactly. So no, it's tragic, and unfortunately, when you're pregnant, your metabolism is at a very high rate, so cancer can be very dangerous, and cancers grow.
Mm-hmm.
So,
And your hormones are very
and
different.
hormones,
Yeah.
everything is very, very different environment. So it's very difficult to make good decisions, but probably the best thing is to do everything in your power to take care of yourself
Yeah.
in every single way if you're pregnant and producing this magnificent creature.
Yeah, absolutely. Well, Dr. Keneally, thank you so much.
You're welcome,
I am
Chris.
such a big fan of your work. Thank you for
well,
the good
thank
work
you.
you're doing.
Well, thank you for good work you're doing.
Well,
Chris.
we're both trying to do some
Yeah,
good
we're
work,
trying
right?
to do it together, and you do it your way,
Yeah.
and I'm trying to implement things that you're bringing to light.
Awesome. Well, so you can find Dr. Keneally at Cancer Center for Hope.
Yes.
Is the website cancercenterforhope.com?
Yes,
Yeah. Great.
cancercenterforhope.com.
Easy to find, easy to connect with. They do take insurance.
We take insurance. I do phone consults all over the world.
That's
I
great.
have one
That's terrific.
patient. I have one patient that I treated just on the phone. He had prostate cancer, and I did a phone consult. He's been under treatment for 1 year, and he only did GC-MAF, and his prostate cancer is 90% gone.
Awesome.
Just
That's
doing
good
telephone
progress.
consult
Yeah.
and GC-MAF. So, and we do a lot of patients because our patients, like I said, come from all over. So they we're able to make. I tell people there isn't anyone that we can't direct and help. There isn't anyone because, and even with your financial budget, there is lots of things you can do on your own to get yourself well.
Yeah.
So it's amazing what you can do on your own.
That's great. So this is a great resource, especially, again, if you have insurance. I know there are some people that want to go to Mexico and they can't afford it, and they're looking for an integrative option in the U.S. Well, this is one.
Yes.
So again, thank you, Dr. Keneally.
All right, thank you,
Thanks for
Chris.
watching, and subscribe to my channel. Check out chrisbeatcancer.com for lots more info on nutrition, natural cancer therapies, and a lot of really, really inspirational survivor interviews from people who have healed.
Yes.
See you next time.
Bye.